The following hour is brought to you by MidasResources.com, your trusted source for precious metals since 1996. Call Midas today at 1-800-686-2237.
Welcome back to the Nutrimedical Report, and we have a dynamic report for you today. And to stop the onslaught of the environmental toxic, literally tsunami of radiotoxins, toxic volatile, fluoride, chloride, bromide, bisphenol A, endocrine disruptors, toxic birth control pill, blood pressure medications, chemotherapy, doping agents for microchips, farm agents, glyphosates that runs off water, it gets into aquifers, all the toxins that are coming from overseas, including nanotoxins that you probably don't even know about, and they're certainly not going to report. Here in America, there's 7 new chemicals every day that are added to the biosphere, to your biology, and they don't have an additive effect, they have a multiplicative effect. They add, in addition to your own gene SNP or polymorphisms of inability to convert, say, vitamins to their final state, or to remove biotoxins to disrupt enzyme pathways, they have a exponential and accumulative effect in the body, and I don't think human biology can withstand this. I really think, and I'm not being a prophet of doom, I think there's going to be a separation here. People that drink clean water, people that kind of start detoxing their bodies now and try to do it on an ongoing basis, with nutraceuticals, safely, and energetic technologies like Proline sauna, pulse magnetic field, etc., and chelating agents. But the very first step is to have clean water. And don't think you're going to get a clean water from any other system. You'll hear hoo-has that are unqualified, that are not environmental docs, that are going to say that their system removes all or whatever, most of such and such fluoride, It's a pile of garbage. The only one that removes all, creates lab-grade reagent equivalent water, and at the end it's so clean you have to add back in 9 to 12 parts per million magnesium, potassium, is the pure water system. It came out of technology to create water clean enough to do a lab experiment that wouldn't be disrupted by toxic, volatile chemicals, total dissolved solids, radiotoxins, fluoride, chloride, bromide, all the other nasties in the environment. And don't think because the water tastes good, or you put it through a filter and it took like the wine out, like that commercial on television about, I'm not even going to mention the name of it. And then all of a sudden that's good, or you got a Berkey and it's got a ceramic element that pulls out the cysts and the bacteria. That's the least of your problems, cysts and bacteria. Yeah, you get diarrhea, which can kill you if it's real bad bugs, right, like E. coli. But the real nasty stuff is going to bioaccumulate, are going to be radiotoxins, heavy metals, volatile chemicals. So much stuff. It's just insane. And people say, well, I got a well. I was thinking, well, that doesn't tell me, well. Let's get a water sample. We find free iron, uranium, radon daughters, heavy metals, arsenic like crazy. I can tell you over the decades so many horror stories of people that said, I got a well. I'm thinking, well, you got a well. And or they tell me the water is potable, it's clean, it tastes pretty good because we're living in Portland. That doesn't mean the water is clean. In fact, they had a water alert a month or so ago. So when I hear this foolishness, it's like, please, unless you've, like Reagan before he had too many aspartame-laced jelly beans, he was pretty sharp. The fact is that if you don't trust but verify, which is Reagan's tag word, you're in trouble. And I tell people, test the water. What's in it? And in fact, I think if they call you Bob, you'll give some labs, but I have labs as well that I can recommend, like Dr. Slonwhite's lab, the AccuChem laboratories, and other toxic labs will measure water, heavy metals, and other nasties. You put it through high-pressure chromatography, you can see hundreds of points. You put it through heavy metal analysis. We use Great Plains Laboratory with Dr. William Shaw. In fact, it's one of my favorite labs. I want to have him on soon. I talked to him as staff earlier today in Lenexa, Kansas. They're the best lab for measuring organic acids, heavy metals in your hair, heavy metals in your stool, if you do a challenge test, etc. People need to get with the program. You are poisoning yourself by just not becoming aware of this and thinking, well, I'm fine, I jog 5 miles a day. Yeah, you are now. You're in the zone of compensation. What happens if you get an emotional strain, a physical trauma, or you hit the wall where all of a sudden some body system just can't cope with something anymore? All of a sudden the springs fly off the movement of your body and all hell breaks loose. And that's what happens. It could be at a certain age, it could be a trauma, it could be an emotional event, it could be a loss of job. It just needs to be enough free radicals, enough toxic other things in your life, and all of a sudden you decompensate. So tell us about the water systems. Why is it so superior? Because I have people that still listen to the program and they still think they can second guess Dr. Deagle. And it's not irritating. It grieves me that people think, with decades of research in this, that people think that they can get a better system by going to Culligan or going to the yellow pages or going online, and they're going to find something better or a better price. You're not going to get a better price either. Our whole system is about half to third the price of a Culligan or other system, and it's better, easier to service. Our water system has the best price and replaceable elements that you can do yourself. It is.
Well, Dr. Bill, there's a saying I've always had, is that there's no product that a man can't find a way to make cheaper and less effective. And
yeah, exactly. I got a call this morning.
The people who are locked into having, the lowest price, that's his rightful prey.
I had a gentleman that contacted me through a friend. He was a consult request, and it turns out he has pretty severe, what we call terminal congestive heart failure, which, by the way, if you get really advanced CHF, you have a shorter survival rate than stage 4 metastatic cancer, especially if you screw around. And if you just take all the conventional drugs that doctors give, they'll kill you. Now, there are some drugs that are safe, and I recommend them, so you can integrate the best of medicine. You can do extracorporeal counterpulsation, you can do home oxygen, you can do CPAP at night if you're getting hypopneic. But you got to take the right stuff, and we have the right stuff. The same thing with water. If you've got heavy metals in your body because your heart's failing, you better dang well drink water that doesn't have heavy metals in it. You better detox your body with things like Proline Sauna, Keeler Max, Liquid Zeolite. But he's a good example of someone, in what turns out 1/3 of the things that I recommended, he got them from other sources. It's like, guy, you think you're going to second guess me and get something better? You're just kind of throwing the dice. You can't throw the dice when you're dealing with life and death. And then you need to be able to go back and test it to see, did this work? Did I do a challenge to see, did the heavy metals come out of my body? Did is my diet actually putting me in a state where I'm actually going to get better from this? I mean, even if you're preparing for stem cell transplant, I was consulted by the Steenblock Clinic, and the big problem they had is people didn't want to do testing. So I recommended the QRMA. And there's challenge tests like the one at Great Plains Laboratory. I said, they said two major things. If people don't have probiotic gut bacteria, and if they have any heavy metals in their body, stem cells don't take. So I have all kinds of people complained over the last few years that have gone in for stem cell transplants. If they're whiners and don't do the tests to make sure they removed and prepared the soil of their body for the stem cells, even if they take their bone marrow out and they get these fancy griseofulvin injections to increase their stem cells, it's like throwing seeds on concrete. It's like, I don't think those are going to take, dear. Those look like they're on concrete. Or they're in gravel, You got them on soil that has to have minerals, vitamins, living organisms. It has to have all the crap out of the soil. Otherwise, how do you expect those stem cells to take in liver, brain, heart muscle, kidneys, whatever? It's impossible. And the first step is water. Clean water.
You've got to have pure water, and it's such a fundamental, and I think this is why people overlook it and don't consider it, is like water. It's just like, all these other things are so much fancier, and they got somebody telling them all kinds of extra little buzzwords, and it's got a gonculator attached and a dopicator attached, and all these fancy things, and it's like they stop and they forget. Wait, I just need pure water for the foundation for any of this other stuff to work. And so you've got to have pure water, and there's a lot of ways you can treat water, but there's only a couple of ways you can purify water.
And by the way, once you purify it, I may be posting on the site, I have things like magnesium and hydrogen sticks that'll add some extra magnesium on top of what already is there, and hydrogen. You can add a little bit of drops of, of lemon or lime, or if you want to alkalinize it a bit, but you don't want to alkalinize water by hydrolyzing it if you haven't yet removed the toxins, because you move the toxins toward what's called our pKa. Now, this is chemistry, people. pKa means a maximum ionization state of the nasty toxins, which means you're really going to suck them up into your body if you move it toward the pKa. You got to get them out first before you...
Free from the shackles of corporate America, we're the place for independent thinkers. GCN.
Yeah, I was pretty motivated. I slept on the lab room floor. Welcome back to the Nutrimedical Report. And Bob, you got a quick statement to make, and we're going to be joined in a second with our next guest, Bobby Walton, and Alamax. The code to use for getting a pure water system is Nutrimed, N-U-T-R-I-M-E-D, and you save 10% on the Bev 100 countertop, Bev 300 under the counter, Bev 200 emergency tackle box, and the whole host system. You can't do better. And please don't try. You will waste your time. The first step in detox is clean, 100% clean water. If you want to alkalinize it, add alkaline drops, add lemon lime, put a magnesium hydrogen stick in it. I don't care, but if you don't start off with clean water, for God's sake, don't get one of these hydrolyzers that break your water. Don't think distilled water, pure water, any other system, Berkey, such and such a system's any good. They're all garbage because there's what's the level of acceptable toxins? How about 0? And you can even get a TDS meter to measure the total dissolved solvents. Very inexpensive. Right from Bob. Bob, how do they contact you? What's the number?
Hey, super easy. Toll-free number, 866-444-9926. That's 866-444-9926. Be sure to use the promo code Nutrimed. Or if you ring us, just tell us that you heard about it on Dr. Deagle's show, and you'll get 10% discount. And thank you, Dr. Bill. Always a pleasure to be on your show.
Yeah, it's essential. It's essential. Right now, especially we're being with radiotoxins and nucleotoxic chemicals in industry every day. If you don't do this, please do this. Don't go and try to get alternative systems. Don't try to get alternative meds from NutriMeds from elsewhere. You're just not going to succeed. And we need to monitor and adjust even to your response. Do testing. Functional testing such as the QRMA is wonderful, Bioplasma NLS. The QRMA is fantastic. Then we can do functional tests through all the functional medicine labs that can do stool, hair, blood, urine, everything you can imagine to tell specifically if we're making the progress. Even gene tests through 23andMe when we get back on track, and there's other gene labs that are available overseas if necessary. You please don't second guess and think you're going to do well elsewhere, whether it's a naturopath, your MD that's holistic or whatever, or somebody recommends different water system or whatever. Please don't waste your time. Support us. Get yourself well. The consults are all free. The nutraceuticals are the best available on the planet, and you're going to do well if you follow our recommendations. Bobby, let's talk about Alamax. I can tell you that I recently had a number of requests. I can't believe I get big rashes of different conditions. The latest one I'm seeing a lot of is chronic lung disease and diverticulosis. Maybe they should call June Diverticulosis Chronic Lung Disease Month. But I get bumps of different illnesses. And I tell people, if you're taking Alamax every day, it'll even stop acne. It's going to stop things like toenail fungus. It's going to stop, intertrigo, where you've got, elevated blood sugar and yeast infections in a fold of skin. It's going to stop problems with external otitis and chronic sinus infections and periodontal disease and, vascular disease that require nanobacteria. Bobby, tell us the latest what you're hearing about Alamax. We have the capsules. We have the drops, which are 10 drops equals 1 capsule. We have the liquid, which is fantastic for eye, nose, ear, and wounds. And the cream, of course. And we have the AliMed, our classical AliMed. All this has been researched for years. It is prescription level. It doesn't develop drug resistance. It is not an antibiotic. It's an antipathogenic. It'll kill all bacteria, pathogenic bacteria, all viruses, all mycobacteria, all fungi. It kills them dead, like the old Raid commercial. And I can tell you, when you take it daily, your life trajectory will be totally different, won't it?
I mean, I'd say it'll be totally different. I'm not going to lie. I've been taking this stuff for around 10 years, and I don't get sick, and I feel better every day, more energetic, and, just healthier. It's a great, absolute great one-a-day capsule maintenance dose that everybody should be on. You mentioned that there's a couple different products. You guys have, the lesser strength and then the stronger strength of the products, the AliMax, and then you also have the AliMed, which is the little bit stronger one. But it's something to have in the medicine cabinet at all times.
Right.
I don't know.
We had a lot of chronic lung disease. We have people with chronic cystic fibrosis. In fact, I recently talked to someone who's a cystic fibrosis respiratory tech, and one of the things that I'll recommend to them is if you get all your cystics on Alamed, it's going to penetrate through and get rid of the Staph aureus, which is chronic, or or it's going to get what's called Proteus mirabilis, or any other we call opportunistic bacterial infection, strep pneumonia, Haemophilus influenza bacteria. These poor cystic patients are loaded to the gunnel, and their mucus looks horrid. But as soon as you start getting them on it, same with chronic lungers that have got giant basket cells producing mucus in their large bronchi, so they got buckets of mucus. As soon as you start doing that, that mucus changes color, gets clear, then it starts reducing the inflammation. Then the amount of mucus drastically decreases. Much easier to do. I worked when I was a medical student doing percussion at the Children's Hospital back many years ago, doing percussion of cystic fibrotics and chronic lungers. And of course, you do what's called cupping, and you pound their chest, try to just knock this mucus free. They use inhalation therapy to try to break it down with acetylcysteine. We have better things now. We have enzymes like our Inflamix that'll get into the lung tissue and break up the mucus plaque. But the regular conventional antibiotics won't get through. Alamax and Alamed will. It crosses through the biofilm. And people are so surprised. They say, you're kidding. If you don't want a diabetic amputation, if you don't want a chronic lung abscess like a bullous abscess in your chest, if you don't want to end up with a chronic infection in your bone, let's say your sinus cavities, Alamax. It's that simple. If you don't want a periodontal infection, so some people, they have a chronic low-grade kind of smoldering intolerance to the metal because they get a steel post or a titanium post put in, or dental surgical teeth problems, they just stay on Alamax all the time and they never end up with mucus and infection around their tooth. But if they stop it, and we've had reports from people say, I stopped it, doc, and within 3 weeks, it came back and I started to have some bad tasting sputum in my mouth. I was thinking, well, why did you stop it? Because I thought I didn't need it anymore. I said, do you know what? You need to stay on this as a preventative forever. Because your body doesn't like that metal post in your face, whether it's titanium or whatever. There's some degree of intolerance, and the bacteria like to line around it, and they'd like to cause a little local osteomyelitis. And if you take the Alamax every day, no problem. The body just cleans it up. It's like a janitor cleans up the crap, and you don't end up with a periodontal osteomyelitis. You don't want that. All of a sudden you lose your dental post, you lose your surgical implantation, you're in big trouble.
Yeah, you are. I mean, this is absolutely something like you were saying to protect your body, to protect your press, to protect your loved ones. You know, people wake up and they have a cup of coffee in the morning, a cigarette, they have their daily routines, and Alamax should be part of that daily routine is what I say. That the product that we're selling is not not a garlic product like people say, comparable to garlic or, any other, garlic companies necessarily out there. The Allison is what's, going to get to the big bad bugs if you have them or stop you necessarily from getting them. We've talked, Dr. Bill, a few times, head to toe, you can use this basically. There's nothing that I wouldn't recommend that, the Alamax necessarily be used for. You can use it, the liquid in neti pots and eyes and ears and, tiny pulse machines.
Yeah, it's amazing. And by the way, if you give conventional antibiotics to children under 5, you increase the risk of autism 400 to 500%. Not so with Alamax. It decreases it, gets rid of the antibacteria, and this is proven with Dr. William Shaw. You can measure the organic acids of the anaerobic bacteria that interfere with brain metabolism, and they're not there if you use Alamax. That's neat. Don't give your kid autism.
Gentlemen, in search of $1 million...
Welcome back to the Nutrimedical Report. And, of course, here in the Nutrimedical Report, we integrate the best of nutrition and medicine. The medical research side suggests that basically the light body, your body, is composed of molecules of vibrating in solution in water. It transmits information. It transmits it through the tight junctions in cells along the myelinated, non-myelinated fiber, and especially along collagen. And it does it along the phenolic side groups where it transmits the frequency of light what's called biophotons along the collagen in your body. That's why your primary superhighway at the speed of light is collagen, and the side groups of phenolic side groups of collagen in your tissues of your body that regulate if you want to call it the bioplasmatic body. The structure of your tissues, your cells, organs are all built on collagen. Research done at the University of Madison, Wisconsin has done research on what's called these ghost organs, where they can take a heart, say from a sheep or a pig, and they can actually flush all the cells out of it and take the connective tissues. And literally, if they infuse stem cells into it, they are getting even a 1 or 2% increase in the pulsatile return of heart muscle function. If they added things like lumen photon therapy, which is light therapy, if they gave the right nutrient bath to support the stem cells, like ergothioneine, which we have in our myco-D2, included other specific, stem cell support nutraceuticals like our Mountain Red Velvet, tendon mender, joint performance, and leptin metabolic. If we supplied all those things to the bath that this doctor is doing research on, she'd probably get much better regeneration. It's preparing the soil. Now, the reason why I say that is that lumen photon, and I've had a number of requests. When people have inflammation, I say, please just use 7 for the setting. Don't use other settings. I've had a recent call yesterday. I talked to a lady, and she was jumping around using other settings. She said it didn't work, and I returned it. And I think she got it through an alternate source. She didn't get it from us. And I said, well, that's not how you use it. You use settings until the inflammation settled. And when the inflammation and pain settled, then you can start kind of throwing in a few minutes at a time, 5-10 minutes, of Nico setting, which I like because it jumps to a few different frequencies. But please don't do that. And also you have to prepare the soil. If the soil is not prepared in the tissues that you've detoxified, supplied the right nutrients for the tissues to have their own stem cells that are in place in the organ or are going to migrate in from the bone marrow, you can't regenerate that organ. You have to supply the right nutrients. But you have to also make sure that you've detoxified, you supply the micronutrients, and you want the end stage converted nutrients for that to happen. So, for example, let's say someone has a knee and they want to regenerate it. We now recommend a combination cocktail of tendon mender, joint performance, leptin metabolic, collagen max, Mountain Red Velvet, and then, of course, lumen photon. And what you want to do there is put it on Nico setting to stimulate regeneration of the knee once the inflammation is settled. And I'll often say use a half an hour or an hour of setting 7 and use 5 or 10 minutes of Nico. Just 5 or 10 minutes, and just gradually over a month or so increase it. So that your endpoint will be, is the inflammation increasing? Then back off. If the knee has got a lot of fragments inside it, you need to go to an orthopedic surgeon and have him do an arthroscopic clean out, which is a real 10-minute procedure, 15-minute, where they put in little drains. I've done work with the orthopedic surgeons and done this because I've taken extra training in orthopedics, plastics, abdominal, general surgery, etc. The only surgery I haven't done is open heart and brain. I've done trauma work, intensive care unit, etc. And they'll clean out the fragments so they don't become calcified little micro laser, called scalpels, slashing away at your connective tissue around your joint capsule. If you're trying to regenerate your liver, you got hepatitis, you got to be on our things to stop free radicals. Cell detox, glutathione, Nutritrella, Regenerex, and cell defense. Bio-LVR and life support. Those are going to help to detox the liver. Then you want the phospholipids to rebuild the liver. Nutriphos, Neurogen, Omega Cod Liver Liquid, Omega Supreme, and Omega Supreme Krill. Those are the primary phospholipids, anti-inflammatory fatty acids. When you do that, you want to also suppress the viral load. So you want to be taking our 3 antipathogenics, Nutriodine, high dose, 20 drops, 3 to 4 times a day. Allicin Med, 2 capsules 3 times a day, and Silver 100 at least 1 spray or 3 drops under the tongue per 10 pounds body weight 3 to 4 times a day. And immunoglobulins, which is in the Ageless or Immunomax or NutriImmune. When you do that and you cut down the free radicals and use cell defense to stop the inflammation and stop the scarring, because you see when the liver gets inflamed, it gets scarred. Then when you want to do a slap on the lumen photon, you want to put it on Nico to stop the inflammation first for a half hour, an hour. Then you just gradually, over the next month or so, gradually increase the Nico settings after you've had setting number 7 for that first hour, 5 minutes the first day, and then maybe 10 minutes over a couple of days later, and you gradually increase it. Your liver's going to start regenerating. It's going to start pulling in circulation, pulling in the stem cells. You can even put the lumen over the bone marrow areas. If you're going to get a bone marrow transplant at one of these bone marrow clinics like the Steam Block Clinic, and you can actually put it over your hips or your lumbar spine where the iliac crest where they're going to draw the bone marrow, and it'll increase your stem cell activation, same way as Somapulse. I often recommend both, lumen photon and Somapulse. And then when they give you the griseofulvin injection, which they'll give you, which is the genetically engineered bone marrow stimulant, you're going to have more bone marrow cells. So lumen by itself will increase bone marrow and for stem cell activation. So if you put it over your heart and you've got hypertension and coronary artery disease or congestive heart failure and you need to activate your heart, and you've now taken CoQ10 and D-ribose and acetylcarnitine and mitocarnitine, mitochondrial catalyst and uridine, triacetyleuridine, etc., slap on the lumen and put it on NICO setting. So, Ron, there's no area, whether it's your brain for stimulating the brain activity with NICO setting, calming the brain down with lumen with setting number 7, activating the pineal gland and the hypothalamus and decalcifying it with our decalcification agents to remove fluoridated calcification of these basal nuclei. Lumen is like a universal machine. It's just, the more I use it, the more amazed I am by its applicability, whether you're trying to stop sinus infection in the bone, stop periodontal disease, or called NICA, which is periodontal cavitations, where the bone's retracting away from the tooth roots, improving bone density in people that have, lack of rebar. So we use a tendon mender, mountain red velvet, collagen max, mountain red velvet, etc. All these things to help improve the bones. Bone generator, micelle D3, myco D2, and the full vitamin K2, menaquinone 7. When people use Lumen, they can increase bone density, say in a lumbar 4 vertebrae that's decreased bone density, or they can repair a shin splint where they got a hairline crack because they've been running and they got a compartment syndrome over it because now they got a hairline decalcification occurring because of trauma, and the traumatic decalcification causing a hairline crack in the bone and the periosteum overlying it is very painful. So I'm sure you hear it like this. I'm finding more applications every day with this. It's just amazing. I mean, of all the devices I have, we have lots. We have hyperbaric chambers and somopulse and pulse magnetic field. The most amazing of all of them is the Lumen Photon.
And it's really simple to use it and use it effectively. It's really the reason that woman had called about using it for inflammation, number 7 is the one for if it's like in your elbow, your knee, or something like that. But I was trying to get her to understand what the difference was between that and using it for the C-reactive protein levels. And she just
by the way, I want you to stay over for the next segment because I want to continue this dialogue and I want to integrate it with our other machines. So if you want to stay over, I want to continue this because I have extra time here.
Okay.
I think it's important that people understand I'm integrating this with regular medicine, too. If someone's had a DEXA bone scan, and I do recommend DEXA scans, but you can't do them more often than 6 months. The first test I recommend for bone density, if someone has problems or thinks they could have a problem, and by the way, they happen in athletes and they happen in middle-aged and elderly. It's not just female problems. A lot of guys have got this guy bias. They think, I can't have bone problems. Well, you're wrong, Mr. Guy. Okay? I have had so many males in their 20s and 30s even that have osteopenia or osteoporosis that showed up on their QRMA test. We do testing and say, my gosh, your diet is crappy and you're eating burgers all day long. How do you expect to have bones? Where are the materials to build bones here, guy? You're eating an acid diet with high phosphates. You're pulling the minerals out. You're eating soda pop. We call it Dr. Pepper bones. With the old Dr. Pepper bones. I discovered that 30-some years ago. And I remember one model, she was eating what we call these low-sugar, sort of aspartame-laced Dr. Pepper drinks. Her bones were like shadows. It was scary. Like shadows.
We are the premier independent talk radio network, the Genesis Communications Network, GCN.
Government. Welcome back, and you know what I want to do in this segment? I'd like to kind of go through a range of conditions to give an idea just how powerful it is, how many different conditions you can treat. And we'll start off from head to toe, toe to head. Let's start off with the toes. Diabetic foot problems. Lumen Photon. You want to put it on the settings to try to stimulate remyelination of the peripheral Schwann cell sheath. You want to improve microcirculation because, of course, if you get the circulation in, you can carry your antipathogenics, Allison Med, Silver 100, Nutridyne. You can prevent anaerobic infection and fungi I remember one of my internist, double-boarded specialist dermatologist back in the early 80s sent me electron microphotographs that showed the nuclei of fungi being pushed literally right into bone and other tissues, which is why diabetics get problems with web space infections, because they have got fungi there and anaerobes. And eventually they get enough inflammatory reaction that they ended up with enough toxins, enough vasospasm, enough microcirculatory problems that they have an explosion of toxins, and they end up requiring demarcation and amputation of toes and feet and everything. Well, there's no need for that. As soon as they start getting microcirculation, as soon as they start the peripheral remyelination, which is lumen photon, and of course our whole remyelination protocol, which is Nutrifos, Neurogen, Omega Cod Liver Liquid, Omega Supreme Krill, Neurogen, all these different nutraceuticals to turn off the inflammation. To improve microcirculation, we use lumbrokinase and nattokinase both, which reduces the blood viscosity, which is high in diabetics. You want to reduce the glycation, which is carnosine and Vein-Away. It'll reduce the glycation index of the tissues. And as you improve the circulation with Cardovite and Supernox, which dilates the blood vessels, and repair the ion channels, which are damaged in anybody with any kind of vascular disease, including microvascular, well, slap on a lumen photon, and we put the pads on, Nico setting again, and we start to see remyelination. First thing they're going to notice is if their feet were anesthetic, they're going to start to hurt again. Secondly, they're going to notice that they can actually feel their toes and they can actually feel the floor, so when they walk, they get proprioception or position sense, they won't fall over. And thirdly, you're going to find that they can actually get much more mobile. Their feet will be higher temperature if you actually did a digital scan of their feet for temperature. Then we move up the legs. Compartment syndrome, deep vein thrombosis. Same thing goes. If you've got problems with recurring lymphangitis or vasculitis of the veins, you want to take our vasculitis protocol, our nutraceuticals to stop inflammation of blood vessel walls, Cardovite, et cetera, like we just mentioned. And then you start applying lumen photon to the area. You want to get natural things in there, our nutraceuticals. Again, setting 7 for inflammation, to reduce the inflammation in the calves, and setting Nico, which is a combination of frequencies. Sometimes there's specific frequencies, like for the eye, if you're trying to regenerate the eye, you want to use setting number 3 for the retina, if you're trying to do it after you've kind of settled the inflammation. Give some of the idea of some of the settings, setting 1, 2, 3, 4, of the target organs those are useful for, but I usually tell people get the inflammation under control first with nutraceuticals and with the setting number 7 before you rush in and start slapping on the higher energy settings, which are the lower numbers.
Yeah, well, the number 3 is the frequency of the ectoderm. That's all the skin, nerve, eyes, all the neural tissue in the body, all our brain. That's,
right. So
everything's sort of linked together because if we didn't have really good circulation, then so number 4 is for circulation, lymphatic situations, and then mesoderm tissue is all the ligament, tendon, cartilage, bone, muscle, all of that. And those are
which frequency is that? Mesoderm.
Yeah. So everything,
which frequency is that? Is that number 4? Mesoderm number 4, right? Number 4?
It's 5. Mesoderm is 5.
Yeah. So basically, let's go a little slower. Let's go slower. Number 1 is highest energy. That is ectoderm, right?
Well, actually we have number 1 is the lowest setting. That one's pulsing at almost visible cycle pulsation right there.
Right.
It's about 63 cycles per second.
Right.
And then number 2 is the primary one for using. That's the one primarily for inflammation, wounds there. 3 is ecto, 4 is endo, and 5 is mesoderm.
But now ecto means skin and brain. Right,
yep.
3, 4 is endo, which means guts, like bowel, liver, kidneys, and then 5 is
mesoderm.
Mesoderm, right?
Yeah.
Mesoderm meaning glandular organs, etc. Right?
Yep. Yeah, that's it.
And then 6 is
it works. It's sort of an adjunctive therapy. I haven't seen really. It works along well with other frequencies in particular, but
in combination.
I don't see much. So
right. Now, of course, what we like with the Nico is it gets a combination of frequencies, so it's kind of a mixed bag. So it's easy for people to just go to Nico rather than trying to select the frequency.
Yeah, by far, most people use that one for almost everything.
Right, so if you're going to have a skin burn, you want to put it on 3 after you've turned on inflammation on 7 to try to heal the skin. If you've got like a hot water burn, if you have abdominal inflammation and pain and you're trying to regenerate the liver and so on, you're going to put it on setting number 4 after you've stopped the inflammation, or you can choose Nico, which is a combination of frequencies. And number 5 is glandular, like thyroid, adrenal, etc. By the way, you can put it over the kidneys, which regulate the ACE receptor and the C-reactive protein, Pi1 anti-inflammatory for the blood vessels. And it's the most powerful way to lower non-pharmacologically your C-reactive protein for vascular disease. And they've done studies on this and proven that lumen over the kidneys, over the low back, basically we call the thoracolumbar junction, will lower your C-reactive protein, which is the best single marker for cardiac disease.
Yeah. And
it's
one of those, if you continue to do this on a regular basis, like two to three times a week for about 20 to 30 minutes, that keeps you in that safe zone.
That's pretty neat. That's pretty neat. It's just a matter of keeping on that frequency. And you're talking about which frequency setting would you put there? Would you put it Nico?
Yes, Nico. Yeah,
Nico over the kidneys. Nico over the kidneys.
Right.
Yeah. So in other words, okay, let's work our way up. Let's say somebody's got cystic fibrosis, chronic lung disease. You want to be putting the frequency, the ectoderm. By the way, that also includes the lung tissue is ecto, isn't it?
The lining, yes, but part of it, it's also circulation in the lungs as well. So, again,
so probably best to use a combination.
Really well in that situation for most lung issues.
So probably Nico would be good. Once the inflammation, if there's not a lot of inflammation there, or if you've taken our nutraceuticals for a while, you'd probably go right to Nico to try to regenerate the lungs if you've got chronic lung disease, because we put a new protocol up, and I recommended lumen.
Yeah.
And of course, we recommend also mild hyperbaric oxygen, home oxygen, 1 to 2 liters a minute. 16 hours a day. There's published research that shows it slows lung deterioration. Lumen Photon, very good, because it's going to stimulate the new stem cells to come in and regenerate bullous emphysema, or help to regenerate the lung tissue that's been damaged by fibrous, we call interstitial inflammatory changes, where fibroblasts have actually generated what we call scar tissue in the lung tissue, so it's not as elastic as usual. So it's going to help that dramatically. Let's say someone's got spinal arthritis. They've got subluxed vertebrae. They've got vertebral pain, chronic pain, myofascial pain in their vertebrae. Or they've got a thoracic or interfascial nerve entrapment, carpal tunnel syndrome, tarsal tunnel in the foot, cubital tunnel syndrome in the elbow. Lumen Photon is very good for that. What settings do you like people to try when they're using it for carpal tunnel syndrome?
Primarily 7, and then Nico. Now, if somebody has really degenerative discs in there, that everything it's going to still be compressed. And it's hard to get that. Sometimes the spine is compressed in there, and the nerves are really screaming, and it helps some to knock off the hardest edge of the pain, but that really requires something else in the back there.
Right. Yeah. And, of course, we tell most people it's the physical anatomical swelling will reduce with things like our tendon mender, joint performance, Mountain Red Velvet, Collagen Max, and our anti-inflammatory. When you add the lumen, you're going to reduce that physical swelling around the nerve roots, and you reduce what's called the cytokine level, because if you can actually draw the dural nerve sleeve levels and you actually send it off to a lab, you'll find very high levels of tumor necrosis factor alpha, interleukin-1 beta, IFN gamma, etc., and when you use lumen, you actually reduce these inflammatory markers along with our amazing NutriMeds.
Yeah.
And they're safer, far safer than the disease-modifying drugs and anti-inflammatories. Far, far safer. Thank you, Ron. Amazing discussion. I'm glad we were able to keep you on a little while today. And I think just stay on there for a second. We'll get you rebooked for next week. We are going to be joined with Tim Alexander on the latest updates on world news from a Christian point of view. Coming up tomorrow, Harley Schlanger, and a major update from Michael Connolly from the U.S. Justice Foundation. You don't want to miss it. We're working hard to get our experts on genetically modified foods in the march on Monsanto. Pray for us, support us, get all your NutriMeds from us. Thank you, everyone out there. Take care.